The cause of your pain isn't where you think it is, and most people that you've been trusting to fix it are looking at the wrong thing. Let me ask you a question. How many people have you actually gone to fix your pain problem? How many people have you looked at online? How many videos have you looked at online to try to fix it and it just hasn't worked? At this point, you start to think that you're broken, but it's much more likely that you're actually looking at the wrong thing, you're getting the wrong information, and you're not taking the right approach. I went to 10 different people, chiropractors, physical therapists, physicians, and nobody helped me. Now, after 15 years of being on the other side of the table and actually working with people, I know exactly where they were going wrong. In the next few minutes, I'm gonna share 5 things that most providers won't tell you. And it's not because they don't want to, it's because they don't know. Once you understand these 5 things, you'll understand why it hasn't been working, but you'll also understand what will. You've done stretches, you've taken pills, you may even have had surgery before, I hope not, but you may have had surgery before, but you're still hurting. It's not because your body's failing you, it's because the approach has been wrong from the start. The first thing to understand is that the site of pain is rarely the root cause of the pain. So whether you're going in and seeing somebody and pointing to your heel, your low back, your shoulder, that's not the pain generator. And that's what trips up almost everyone. When you go see a practitioner, they're treating the site of pain. What we need to do is go above and below, up and down the chain, and figure out where the root cause of the problem is, because where your pain is at is just reacting to the root cause. The body's all connected. So if something's not functioning properly, or muscles aren't gliding across each other, or we have a muscle imbalance, then that affects things up and down that chain. But it doesn't mean that that's the source of the pain. So we've got to make sure that we're more comprehensive when we look at something, and that, like, just thinking about videos that you see online, if you have plantar fasciitis, and people will say, roll out on a lacrosse ball, or frozen orange juice, I've seen that somewhere. So rolling out, that's the area where you're having pain. But going up the chain, down your foot, but then up the chain into your calf, into your hamstring, we're getting muscle pulls and glide. We need to redistribute stress. The site of pain, if you're digging on it, is typically just gonna make it worse. So if you've been treating that site of pain and thinking, what's wrong with this spot? Get away from that and start thinking, what's happening around it? The second thing, the body breaks down in predictable patterns. There's specific areas that should be mobile, where we should work on mobility, and then there's areas where we need to work on stability. For example, if your hips are really tight and your thoracic spine is really tight, then it makes our lower back, the area right in between, move too much. And the same thing when we have stiff ankles and stiff hips, that our knee moves too much and we're wearing out those areas. So instead of working on the area that's painful, we need to be looking at increasing mobility above and below that segment to decrease that stress. The third thing is that muscles move bones. It's not the other way around. So in Western medicine, we go straight to the joint. We say, hey, that's the deepest structure, so it must be the problem. There's joint degeneration, irritation, fraying, bone on bone, grinding, arthritis. Those things are there, but if the muscle moves the bone, then we're closer to the root cause of the problem. If we're addressing the muscle, we have muscle tension, we have imbalances, and those muscles are pulling and creating that grind. So if we go in and we actually address the muscle, we're getting to the root cause of the problem instead of replacing it or repairing it when it's absolutely not necessary. The fourth thing is that most providers focus on one approach. So a normal chiropractor, traditional chiropractor, just does manipulations. Normal physical therapy is stretches and exercise. A massage therapist does soft tissue work. And then an acupuncturist does needling. To us, those aren't a discipline, those are tools in the tool chest. We're not gonna be needling from here on YouTube, but that's not what we have to do. What we need to do is teach somebody how to work on muscle tissue. There's various ways to do it. So what we wanna make sure that everybody's understanding that we are loosening up muscle tissue, and we need a combination of approaches to get the system to change. So we've gotta loosen up muscle tissue, fire up the correct muscles, and then work on our movement patterns and build strength and stability in the proper movement patterns. And that's how we get long-term change with the body. Finally, number 5, one of the most important things that we do is a hip hinge. It's moving through the hips. If you look at your body and you cut it in half, we're not going to be cutting you through your abdomen. We're cutting you through your hips. So we've got to make sure that we're firing up the muscles on the back side of the body. We shift the hips back, we load up our hamstrings and our glutes. And when we do that, we're redistributing stress out of our lower back. We're pushing it into our hips. And if we do that consistently, we change the movement pattern. The latest research says that 320 to 360 repetitions is what's going to teach us. It's going to get our brain to start firing the correct nervous system. We're going to create a pathway. So the nervous system fires those muscles together. And so we need a consistent approach. And so in our videos, we talk a lot about hip hinging when we're trying to get a long-term solution. So we want all of our clients, all of our people that are following us to do our exercises with repetition. So we're doing 30 repetitions, we're doing it twice a day. So we're making sure that we're changing the movement pattern in our brain. And that hip hinge is one of the most important things that we learn. And so we want to make sure that everybody that follows this channel is learning how to move through their hips, because that's where our force generation comes from. And there's a process. I've been doing this for 15 years. There's a process to teaching somebody how to move through their hips again. When I do presentations, my son, I have a picture of my son up there. He was 18 months old and he did a perfect hip hinge. And I caught him at that moment, took a picture of it. And we talk about it every time I do a presentation. We're born perfect. We move extremely well. And somehow over time we lose it. And it has a lot to do with that we're sitting for long periods of time. We get tight on the front side of the body and the muscles on the back side of the body are not firing anymore. Creates that imbalance. And so I want to focus on number 5 right here, that hip hinge is so important that we get it down and we're consistent with it and we really understand that movement pattern, because when you get that, it's a linchpin. This isn't an overnight fix. This is the real fix. This is what's actually going to get you long-term improvement. With consistency, this will change your life. Your body is not broken. We've got to make sure that we're moving through the right patterns and we're taking the correct approach. And we're going to fix your body and you're going to get back to doing the things that you love.